On this anatomical drawing, we can see that the kidneys are located in the retroperitoneal space. Both renal vein and arteries are emerging nearly perpendicularly to the adjacent caudal vena cava and aorta, while the ureters are diving caudally nearly parallel to these vessels. The kidneys are bean-shaped in the dog, and the right kidney is slightly more cranially located than the corresponding left. The internal architecture of the kidney that can be evaluated on ultrasound includes the cortex, covered by the renal capsule, medulla with the pyramid spaces, the collecting system with the pelvic recesses, and the renal vasculature made of the renal arteries, vein, interlobar, and arcuate vessels. Ultrasonographic assessment includes sagittal and transverse plane through each kidney. On the right, we see the corresponding images of the transverse scan through the cranial pole and center portion of the kidney on A and B, respectively. The spleen is present in the near field on these two images. The renal cortex can be seen hyperechoic to the adjacent medulla. The urine in the pelvis is barely seen on this image. Fat is noted at the hilus around the renal vessels, and on the longitudinal scan, the contrast between the cortex and medulla can well be seen. On the sonographic images, color Doppler signals outline in blue and red the venous and arterial flow. By convention, the red represents flow towards the probe, while the blue color represents flow going away from the probe. The shape and internal architecture of the kidneys slightly differ between the dog and the cat. The kidneys in cats tend to be more rounded and oval shaped than in dogs. Let's start the real-time evaluation of the kidney in this beagle placed in dorsal recumbency. The probe is located on the lateral aspect of the left mid-abdomen with the marker of the probe pointing to the head of the dog for a sagittal approach. Notice that during the scanning, the probe is gently in contact with the skin without excessive pressure. The spleen is located in the near field, and the probe is gently displaced from lateral to medial and medial to lateral to cover the entire width of the kidney. The probe is then rotated 90 degrees to obtain a transverse image through the kidney. Several segments of intestines and colon are seen in the near field as we move the probe. The color Doppler is activated to best outline the renal vascularization at the hilus and in the periphery. This is done now with the kidney in longitudinal axis. The power angio mode displayed similarly the vessel, but this time in only one color without discrimination for the direction of the flow. This mode is more sensitive to low velocity vessels. To evaluate the right kidney, the probe has to be placed more cranially than on the left side. I frequently follow the rib cage and place the probe at the end of the dorsal margin of the rib cage. The probe is then oriented slightly cranially to best see the right kidney as it sits within the renal fossa of the liver. Small bowel with gas in the lumens may be seen in the near field and will somewhat limit the evaluation of the kidney. The probe is then rocked from medial to lateral to fully evaluate the kidney on longitudinal section. The probe is then rotated 90 degrees to obtain a transverse scan. Colorflow Doppler evaluation can also be performed in two planes. The distinction between cortex and medulla is clearly seen on this kidney.